Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Hugo Turner joins me to speak about capacity strengthening. Hugo, your work focuses on global health, and with a red thread being capacity strengthening. Can you give some examples of projects?
So one of the projects I've been working on with a range of partners, including HITAP in Thailand, is developing a series of open access papers that explain key areas for conducting economic evaluations. Our real goal is to provide a foundation that are new to that area and want to learn more and apply it to their research. Recently published include an introduction to economic evaluations that explains the differences between the main types. Published one that explains why economic costs instead of financial costs are used within economic evaluations. We've provided a guide for adjusting for inflation, designed for those that have no prior knowledge. And finally, we've recently published one that provides an overview of the perspectives and viewpoints taken within economic evaluations and explains their implications.
And can you tell us a bit about how these projects came about?
So, I now specialize in economic evaluations, but my background's not in economics. I came from modeling and infectious disease epidemiology. So, it's a shift I made during my PhD. And although there's some great resources and some great textbooks, I often found it challenging. And there's some real gaps for how you should apply those techniques to low and middle income countries. So I really wanted to make that shift easier for other people, effectively writing what I wish someone had told me 10 years ago.
And what are your next steps now going forward?
So we've published 4 of these. We've got another 4 that are being drafted that we're hoping to publish over the next few years and expand the project. I also want to expand more generally and refocus on capacity strengthening for infectious disease modeling as well, taking some of the lessons I've learned from this project.
Wonderful. Thank you so much for your time.
Thank you.